just on the issue of TB.
Yeah.
And it's not for this committee at all, but the issue in relation to money and risk is, and a similar, earlier this year in Galway in the hospital, a patient with TB was left in a way that exposed other patients. This is all in the media, the exact same repeat. And a certain number of people contracted what's called latent TB, and the handling of it and the exposure of it, and this is all factual in the papers, certainly left a lot to be desired. And now we have people naturally going the legal route to get due redress in relation to it. So it's exactly, and this is this year in the 21st century, in the hospital. So all the policies are there on the ground, and all the policies I see referred to here in the prison service. But actually the operation of those policies is the next question.
Absolutely. And the risk management. So you're right, and they're the issues that prevention is better than cure, and I think and the firm, absolutely. So look at more observations.
Isn't it a much bigger issue? I agree with you what you're saying, but isn't it a much bigger issue? I think of Galway, Carrick Great Southern, owned by the state, and right beside it is the GMIT. They're struggling for accommodation. The state sells off the hotel. It ends up in liquidation. It's back in some private hands again, and they're seeking to buy it back. They're right beside each other. It couldn't be a more acute picture of idiocy and madness. And the hotel remains empty to this day. It was, I'm repeating, owned by the state, two beside each other, one institution struggling and the other. Isn't it a bigger issue about public buildings and acquiring public buildings and departments talking to each other and getting the building? In the first instance, it shouldn't have been sold. It should have been acquired by the Department of Education. And that's happening all over the country.
And of course, then we have Harold's Cross.
Yeah. Barking mad.
Okay, look, we're just dealing with the education bit here now, and the HEA has a role as well. So we'll write back for the department. You know, there needs to be. It's not easy, but the point is well made. You know, it's totally reasonable what we've suggested. Maybe it's complicated, but it's very reasonable what we're suggesting. And what we could all probably find myriads of cases.
But it's important to mention those because it is a bigger issue. It just comes into focus with Harold's Cross, or it comes into focus with something else. But continuously we're doing it.
But I'll give you a simpler practical example that we'll all understand now. In every town and city in Ireland, there are different approved housing bodies funded by the state competing with each other to buy sites so they can build their houses and their units. And they're driving up the price. It's actually happening everywhere now, between approved housing bodies and local authorities often competing against each other. I've seen it recently. So I think there's a big point there that we'll come back to, but you know, it's the tip of the iceberg what we've touched on. That's all we can say at the moment, you know. But
I've often mentioned Kafka, and really it's reading Kafka here now, because the single assessment tool, I don't know if you're familiar with it, but they use it for home care assessment.
Yeah.
And it was run out as a pilot project. It takes at least 2 to 3 hours to administer that from a computer answering questions. And so you're assessing someone's dependency on a computer with a single assessment tool. It's absolutely time consuming, and at the end of the day when the assessment is given, just as an example now, Chair, I know it's minutiae, but that's what they're delaying. They're going in now to meet people to do a single assessment tool assessment on them with a computer and a standardised questionnaire. Clinical judgment seems to have gone out the window, where a doctor and a nurse will say, you need this or you need that. And we're back to a computer and a special assessment tool. And then the result of that in Galway, and I can give 2 specific examples, somebody looking for home care, somebody with dementia, early dementia, in their 60s, has qualified for 10 hours home help as a result of that single assessment tool. I've lost your attention, and I understand that, Chair, but that I understand it's the minutiae, but it really is difficult to look at that single assessment tool now. It raises all sorts of other issues in relation to what's happening with our health and our approach to looking after our people. And I certainly wouldn't like any member of my family assessed on that computer and that single assessment tool, nor I would like any of my colleagues here. I would like to rely on somebody's clinical judgment and their expertise as a nurse or a doctor.